we'll start with something new. Okay. Uh, Fine. Like, what exactly I wanted to ask must be this a small mix-up. See, what are all the common sources of homeopathic medicines? What are the common sources? So we have, I should not ask this question for a PG scholar, but then to just start with the class, you have remedies prepared from plants, and you also have remedies from the animal source. Then minerals, yeah, we have got plenty of medicines, from the mineral source, and of course you also have medicines from imponderabilia, okay, and then you have medicines from sarcodes, and of course you also have medicines from nosodes, okay. See now, okay, this is what I wanted first, okay, so small recall of what remedies we have, what are the sources of homeopathic remedies. So you have guessed it right, we have some 6 majorly, and this is what will add to the major chunk of our remedies. So we have some 5,000 plus homeopathic remedies, okay. See now, understanding all these things are also very, very important. For example, there are people who prescribe only on the group. Like for example, this lady belongs to plant, or this person belongs to animal, similarly, okay. So we have different methods of understanding materia medica. So now in today's class, we'll be focusing on a very important area, and that area is understanding nosodes. So you just told me there are plenty of nosodes, major nosodes in your PG syllabus. So what we'll try to understand is, we'll understand the basics of nosodes, and slowly what we can do is, we'll look at the major nosodes, okay. So when I say the basics of nosodes, what you need to understand is, we are going to define nosode, first thing, in today's class, and we are also looking at the different examples of nosodes, okay. That will be our second objective, and very important is indications and contraindications of nosodes. Okay, when do we commonly think of nosodes? From the practice point of view, and of course from the theory point of view. We'll try to do justice for both. Okay. So the first question here is, what is a nosode? And I'm asking this question with confidence because this is something you would have already studied in your final year or third year BHMS. Okay. So what exactly you understand from the word nosode? It is prepared from the disease product. Okay. So if you want me to be more precise, and what you'll have to realize here is, the term nosode is derived from the Greek word nosos, meaning disease, and kodos, meaning appearance. Okay. So this is the word meaning, and if you read the literature, if you look into the literature, till date I was of the opinion Dr. Herring was the first person who introduced or who proved nosode. But when I was referring some other books today for your class, I also realized that it was Dr. Hahnemann who first used the nosode umbra gracia in 1827. And if you also read Herring, okay, between 1827 to 1833, Dr. Herring also seriously works on the nosodes. Fine? Okay, so few books say Dr. Herring, Sorenum, and a few more books say Dr. Hahnemann, umbra gracia. Okay, anyway, so Dr. Herring, if you remember or if you recall, he has done a lot of contribution. He has contributed a lot towards homeopathy. Fine? Basically an allopath who gets converted to homeopathy and is contributed a lot. So his contribution towards nosodes again is very commendable. Okay. To the extent one author says he was the one who coined the term nosode. Right? Okay. And if you just see here, Herring performed the first proving of sorenum on himself. He originated the method of using a miasmatic agent as a basis for a remedy, and it was he who coined the term nosode. Okay. This is just the brief introduction about nosode. And you also have something called as bowel nosodes. Okay. So when we prepare nosodes from the human gut bacteria, those we call it as bowel nosodes. Okay. So after defining and after giving you the basic information about nosode, we'll also look at a few examples. And this is something you can answer from your past knowledge. So what are all the common nosodes we have? And let me complete. And where do they originate from? Okay. So when we talk of origin, now things will become more clear. So the nosodes can originate from the human source. The nosodes can originate from the animal source, and they can also originate from the plant source. Okay. So these three things you will have to be very, very clear. Right? Now if you look at examples of nosodes prepared from the disease products of human being, now we have a set of remedies in our materia medica, and there are some 55 to 60 nosodes in our materia medica. Okay. So like for example, you were talking of, now can you tell me the examples from the human secretions or human disease products that we prepare? Bacillinum, yes, absolutely right. Tuberculinum, carcinosin, sorinum. Okay, syrinum, yes, syrinum, okay. I have given few. The list might be more. This is only a small introduction about nosodes. Okay. So the list may be bigger. You have carcinosin, and it is prepared from the tissues of liver metastasis. And then you have bacillinum, it is prepared from the sputum of the tubercular patient containing the bacteria. Okay. And medullinium from the purulent gonorrheal discharge, and the condition is that gonorrheal discharge should have Neisseria gonorrhoeae, the bacteria which is causing gonorrhea, that should be present. And of course morbillinum from exudates of mouth and pharynx of measles affected patient. Okay, and you also have OEN, osteoarthritis nosode. Okay, so what they are doing is from the affected knee joint of a patient with RA, that synovial fluid is removed and then they prepare OEN. Many times used in osteoarthritis, OEN. Similarly, there is something called as RAN, rheumatoid arthritis nosode. Okay, and you have tuberculum, which it is prepared fused from the tubercular lung. A person who is affected with tuberculosis, but the condition here is you should have the active presence of the bacteria, Mycobacterium tuberculum. Okay, so these are all prepared from the human. Okay. Now quickly, when we look at the nosodes prepared from the animal products, okay, melandinum, ambragracia, yes, good ambragracia, lysine, beautiful remedy, lysine, and you also have anthraxinum. So anthraxinum, liver of rabbits suffering from anthrax. Ambragracia, it is the morbid secretion of the sperm whale. Okay, and you also have melandinum, discharge of eczema in the folds of the knee of horse. And then pyrogenum, a remedy which we all very commonly use. It is prepared from the decomposed beef. Okay, and there's a big, when we take individual nosodes, you'll get a clarity, and we'll spend few minutes talking about So we'll spend few minutes talking about how it is prepared in the later classes when we deal the nosodes individually. So you also have vaccinum, which is prepared from the lymph of the cowpox. Okay, these are a few examples of animal vaccines. As I told, there can be many more. So the last thing I want to focus here is you also have homeopathic remedies prepared from the disease product of plants. Okay, fine. So any wild examples? Huh? Okay, Ustilago is a fungus. Ustilago, sickle corn. Okay. Then agaricus. Agaricus is also a fungus. Okay. Right? Agaricus, sickle corn, Ustilago, and this is the source from where we prepare the remedies. Okay. So agaricus from entire fresh fungus found in dry pine woods. Sickle prepared from the fungus Claviceps purpura growing upon the seed of the sickle cereal and other grains, and Ustilago prepared from the fungus growing on the stem grains of Indian corn. Okay. So these are few remedies. There are many more. You can go back home and leisurely refer. Okay. So two important objectives that we have covered. One, we have defined what a nosode is. That's the first thing we did. And second thing, we have given some examples from animal source, plant source, and of course from the human source. What are all the common nosodes one uses in homeopathy? So we have discussed that. And now more important is indications. Indications and contraindications of nosode. Okay. Now, to understand this, you should also talk a little about another system called as isopathy. Heard of isopathy? Fine. What is isopathy? Same product. Okay, some same product?
Same person.
Suffering.
They give it to.
Okay. So there is something called as isopathy. One Dr. Lux introduces it. Okay. And nosodes are many times confused with isopathy. You should have a small clarity. Okay. So now what I also want you to understand here is, when you look at the indications of nosodes, what is the first indication of a nosode? Or what, according to you, are the probable indications of a nosode? When there is a miasmatic block, yes, agreed. When a well-indicated remedy fails. Okay, yeah, I have also written that. But now the question should come to your mind, why is a well-indicated remedy failing? If it is very well indicated, it should not fail. Similia similibus curenter. Okay, but I have also given you some 10-12 situations where nosode can be indicated. Okay, fine. And I don't practice all the 12 in my practice. But as a PG scholar, as a PG teacher, there are a list given, I am giving you the list. Okay, because you also need to write in your exams. But we'll also try to use our common sense and try to understand where and when a nosode can be indicated. Now, nosodes are nothing different. They are prepared as per the rules of homeopathic preparations. And all these nosodes are proved. If you recall the first slide I told, Dr. Hahnemann proved Umbra gracia on himself and his friends. Dr. Herring was the first person who experimented with Sorena. Meaning, they are undergoing, the nosodes are also homeopathically proven. And this is very, very important. So when they are homeopathically proven, what will happen? Now what will happen? You know, what is the result of drug proving? Symptoms, correct? No? So what I want you to understand very clearly, that the first indication of a nosode is, this is what I was trying to tell you. The patient is sitting in front of you. Does he require a nosode or does he not require a nosode is what you have to understand. Now how do you decide if he requires a nosode or not a nosode? Depends. If he is a person who is presenting to you with symptoms matching that of a nosode, he definitely requires a nosode. Okay. So what I am trying to tell you here is, the first very important indication of a nosode, you PG scholars should have in mind is it can be given as a constitutional remedy. Very important. And that's why I'm trying to tell you in the background that a nosode is also proved like any other source. So when it is proved, the patient is coming up with symptoms. Fine. So there can be mental symptoms, and this is what you saw here. There can be common symptoms, and then there can be some PQRS symptom. So based on the body, mind, and of course the PQRS, we prescribe, and this is what we call it as a constitutional medicine, when the mentals, physical generals and particulars are matching with those of the given patient, and characteristics are matching with those of the given patient. So the first very important indication is this. And when we start dealing with the individual nosodes, we'll talk of examples. Like for example, soranum can have its own drug picture. Pyrogenum can have its own drug picture. Tuberculinum, carcinosin, the common nosodes, they have beautiful drug picture and they can have their own individual drug pictures. So first indication is constitution. And second thing, now whatever you are trying to tell. See, sometimes that's why I am trying to tell you this thing. It depends upon the patient and it also depends upon the doctor who is there. So there are situations where you may not get typically body, mind, PQRS, etc., etc. Okay. The issue can be with the patient or the issue sometimes can be with the physician himself. So what you also need to understand is, when you have too many symptoms, you can use this. When you have too less symptoms, or when you have few symptoms, you have tried your best as a physician to elicit, but unfortunately you are not getting what you want. So when there are too minimal symptoms, okay, and why there are few minimal symptoms? This is with few symptoms in whom the miasmatic state remains in a latent form. So the miasm is not fully bloomed. It is in the latent form. It is not expressing itself in the form of symptoms, or it is expressing itself in form of few symptoms. Okay, there you can think of a nosode. One-sided diseases. Okay, one-sided diseases can be an example for the indication of a nosode. Now, if you just look at the Google image we have taken, now this is what many of you were telling. When you are the physician, when the indicated remedy fails. Now there can be many reasons why an indicated remedy is failing. What are all the common reasons? Okay, maintaining cost. See, the first thing I feel is, I, the physician, think it is indicated. You get my point? I think it is indicated. Many times we tell, no, sir, he is typical Barretta. And it did not work. You are getting the seriousness of the statement. And what is the question we ask? Or what is the question, what is that you get in your mind when somebody says, so it is typical Barretta and it did not work? The first question is, it is not Barretta then. Yeah, it is not Barretta. See, when it was Barretta, as per homeopathic principles, it should have worked. But it is not working. Why? Okay. So when an indicated remedy fails, so now you say the indicated remedy is failing because of a maintaining cost, possible. Any other reason why an indicated remedy is failing? Okay, for example, we assume we get prejudice that it is the indicated remedy when it is not the indicated remedy. Right? Okay? Done? Okay. So when an indicated remedy fails, they say you can think of a nosode. For exams you can write all this. When the indicated remedy fails, when the well chosen remedy fails, think of a nosode. Now we'll also realize in the next few or probably after this slide, what will this nosode do? When an indicated remedy fails, what will the nosode do? Okay, you should have come here, but anyway, please keep this in mind. I'll come back to this. Now what is this fourth indication I am trying to give you is never well after a disease. What is it? Never well after a disease. Okay. See, this is something we commonly get to see in our clinics. Sir, I had viral fever. Okay. And after viral fever, my appetite has gone. I had influenza. Okay, viral flu. After viral flu, my appetite has decreased. Okay. So, never well after a disease. So here, many times the remedy influenza is given. Bad effects of influenza. Influenza is given. And it is observed influenza improves appetite or whatever remaining weakness. Done? That is one situation I am giving you. And many times you also have women coming to our clinics where they say, sir, I underwent abortion and since then, I am not feeling good. Okay? Done? So one beautiful nosode you can think of is pyrogena. Never well after an abortion. Never well after a septic condition. Again pyrogena. Okay. So these are few examples. You can add many, but I am just giving you an insight of indication of indication of nosodes. General indications of nosode. So never well since. When the complaints directly dates back from an acute illness in the past which was either suppressed or did not run its course. So influenza was either suppressed or influenza, the flu did not run its course, and after which patient has some issues, you can think of the remedy influenza. Never well since, and this is what I was trying to tell you. Why the well-indicated remedy failed? Why the well-indicated remedy failed? So if you just see here, what do you see from the image? There is some obstacle, there is some block. The obstacle can be maintaining cause, or a little higher if you just look at the obstacle can be a miasmatic block. Fine. So in such situation, you have taken the case twice, thrice, and it is a typical Barretta and still Barretta is not working. Probably this situation the patient requires an anti-miasmatic remedy, and majority of the times the anti-miasmatic remedy can be a nosode. Okay. Now how do you decide an anti-miasmatic remedy? How do you decide an anti-miasmatic remedy? So anti-miasmatic remedy is decided based on the past history and the family history. Okay. What diseases you have suffered in the past or the hereditary lineage. Fine. Diabetes, hypertension, growth, ulcer, destruction, healthy family, whatever it is. And what you are suffering. All that you mix, you combine, and then you decide the predominant miasm, and then you prescribe an anti-miasmatic remedy. Okay. Fine. So now what will this anti-miasmatic remedy do? It will remove the block, okay, and it will help in recovery. The block might be removed and that remedy can cure him. Okay? Or block is removed and nothing happens. So in this situation, what do? You will have to again prescribe the constitutional remedy. Okay? Hope I am clear. See, these are very important, taken from different source books. As miasmatic intercurrent medicine helps to clear out the miasmatic obstacle, the nosode is selected based on the family history, past history. After the prescription, if the patient improves, wait. Okay. If the patient does not improve, then you have to repeat the previous constitutional medicine. And now it works wonders. Okay. So this is the fifth indication of the nosode. Sixth, in one aphorism, Dr. Hanuman says you should build up the portrait of the disease. Which aphorism? 6. Unprejudiced observer. So the part of that is the portrait part, if I am right. Okay. So what is happening is, when you are not able to build up a portrait, say, I mean when I say when you are not able to, it might be your limitation. But you have given a 100% as told by Dr. Hanuman in his organon procedure is not very clear. It is not fitting into any simillimum. You are not getting the exact simillimum. Okay. When there is a partial portrait of the disease and no medicine completely fits the case. Okay. So again, whatever the latent symptoms are hidden, after you give a very well indicated nosode, those symptoms can come up, giving you a path or helping you complete this portrait. That can also be a part of the indication of the nosode. Okay. So sixth, and then we have the seventh. And again, I feel you can appreciate from the Google image what is it that I am trying to tell. What is this gentleman doing? So if he removes his hand, what will happen? So what is he trying to do? He is, okay, yeah, what is the other word? He is trying to prevent. Okay, good. So many times, nosodes are used as a prophylactic. Okay, fine. Can you think of some examples? Variolina. Many times, we have a situation in clinic. Parents come, sir, my younger daughter has chicken pox, and I have a 2 months old or 3 months old baby. Fine. We tell them not to keep them together, etc., etc. In spite of that, a remedy that can do wonders is variolina. It can prevent. It can, but many times they might get. But there's a possibility of it preventing. So as a prophylactic, variolinum can be used in chickenpox. Similarly in other conditions. Okay. So nosode as a prophylactic. Right? And one more extension of this, what Dr. Honeyman talks in his organa, is nosode as genus epidemicus. You'll have to be a little careful. Not necessarily it should be a nosode. Belladonna has done wonders. During COVID, arsenic has done wonders. I hope you understand. So Dr. Honeyman in one aphorism, I am not sure, 110, kindly confirm, don't go by the number I am giving. But in some epidemic disease when he is talking, there he says, there he gives the instruction to the physician how exactly you are going to select a genus epidemicus. What are the criteria? How do you select? That he gives you a clarity. So nosodes can do wonders in genus. Nosodes can do wonders as genus epidemicus. I was with one of my friends from Surat, a very good homeopath, successful homeopath. He was talking of anthraxinum. He was narrating where there was this pandemic in Rajasthan where thousands, lakhs of cattle died. Okay, and then this gentleman with his team, they studied, they understood what exactly is the situation there, why they are dying and all. And then for a few cases, based on the symptoms, they prescribed anthraxinum. For a few cases, they gave pyrogenum, like that. And lakhs of cows were prevented from suffering. It's a genuine study he has made, and beautiful improvement. So it was used as a genus epidemicus there. Okay, and the cattle were prevented from dying. It was spreading very fast, it seems. So all the videos they have taken, they have understood the disease, and then accordingly they have prescribed. So as a prophylactic, as genus epidemicus, for example, based on the disease. So this is what, when the remedy is related to the disease genus. For example, pertussin against whooping cough, or any complication caused by vaccination. Based on what the complication is, you can prescribe a nosode. Okay. Vaccininum itself is a beautiful remedy which antidotes the bad effects of vaccines. We'll slowly understand all these things because it will stretch for next 6 months. Weekly one class, and we have bigger remedies to discuss. So we'll slowly try to understand. But keep this in the background so that you get more clarity as and when we share the remedies. So another indication of nosode is when you have changed pictures coming up. You prescribe a remedy and something new is coming up. You prescribe for that totality, something new is coming up. So constant changing of symptoms after administering a drug. Okay, you administer a drug and you get different pictures. So there again one can think of a nosode. And nosodes can be prescribed as a pathological prescription. Okay. For example, though we don't advocate this, at the same time there is something called as a pathological totality. Sometimes you may not get mentals, sometimes you may have to prescribe only on the pathology. So there again we make a small totality relating to the pathology and we prescribe. So majority of the nosodes can be used for pathological prescription. Medorinum for any psychotic growths. Okay, but don't take me very seriously because there are a lot of remedies which can do wonders in growths. But if you are looking at a nosode, medorinum can do wonders. Similarly, syphilinum for ulcers. Similarly, soranum for any psoriatic conditions. Okay. So, as a pathological prescription, and the last very important thing here is autonosode. So, whatever disease you are suffering, that disease part is taken, it is potentized and it is given to the patient himself. Autonosode. Okay. So I don't have much idea about this, but anyway, it's an indication. As a PG scholar, you have to write in your exams. So quickly recalling the indications, what exactly we have is, see, for me as a practitioner, to be very honest, I have used nosodes from my experience basically as a constitutional remedy, and I have also used this as a prophylactic. I gave you the examples of chicken pox, okay, done, or for example whooping cough. Though we don't see it much, I am talking from the past experience of 27 years, it is possible. Chicken pox and other things, fine. But then you also have to remember there can be different other indications, like for example as anti-current, anti-miasmatic remedy, okay, or when you have two less symptoms, one-sided diseases, or when you are not getting the complete portrait of a patient, you have a partial portrait and you are not able to fix into any remedy, or every time you give a remedy the picture is changing. Okay. There again it can be given. Done. Now I have given you the indications. Any more indications that you can think of? If you have anything else to add, what you have studied or what you have seen from your clinical experience, you can always contribute. Okay, so if there's nothing, we look at the contraindications. Now, what are the contraindications of nosodes? Again, I have taken it from online, few books. Okay, in the active phase of a disease. Fine, good. Active phase of a disease, then?
Should not be in low potencies.
Okay, you should not give it in low potencies. Yes, agreed. Correct. Yeah. So, one very important thing is in any advanced pathologies, in any advanced active pathologies, fine. Generally, we don't think of nosodes. Like for example, cancer, advanced cancer, fine. Generally, unless indicated, don't simply give off carcinosin. It is not indicated. Then again, in active state, in acute state, in advanced stage, why do we say don't give carcinosin, or why do we say nosodes are contraindicated is the human being, the patient, his vitality will be very, very, very low. Okay. So those situations, they say one should not think of a nosode. Active phase of a disease, okay, one, and then during the incubation of the disease. Now what is this incubation? From the time you are exposed to the symptoms, okay, that interval, incubation period. They say it should not be given. And then you also have in acute explosive stage of the disease. Okay. So again, indirectly what all these things tell you is, during all this stage, the vitality of the patient will be decreased. So they say you need to be a little careful. The last thing here is, autonosodes during the acute infectious disease should be avoided. And Priya was talking about the potency part, very important. We don't have medullum 6. I mean, we means at least I don't have that in my clinic, because too low of nosodes, too lower potencies of nosodes, generally we don't use. Okay, at least what we use is 200 and above. That is my experience. I don't have experience with low potencies. Okay, when it comes to nosodes, I have 200 and higher. And generally nosodes we don't repeat. We don't repeat it often. See, but these are all conditions apply. Okay, but when the disease is long lasting, it is psychotic, if there is a need, it can be repeated. Okay, it can be repeated. Okay, so I hope you got a clarity of what a nosode is, and examples for nosodes, and we also spoke of indications and contraindications. For a PG scholar, if you are looking only at the theory part, it can be a 5-mark question. Okay? Or if you are lucky, it can be a 10-mark question. From that unit, you can get this question. Or many times they ask indications and then they introduce a small nosode. Vaccinum or picuras of pyrogenum or mind of carcinosin, it might be clubbed. Okay. So this is the basic thing, and next class onwards we will explore the individual nosodes. Okay, so I'll be getting a chance to share carcinosin, correct? Pyrogenum, sorinum, tuberculinum. Is tuberculum there in the syllabus? Okay, and medullum. At least these 5. Syphilinum. Okay, good, syphilinum. At least, okay, chala, lysinum. Any more? Yeah.
Lab can.
That will come under. No problem. That's a sulfur. No problem. Yeah, we'll discuss. At least let's start off. Let's start off with something, and then we can continue. At least these 6-7 major nosodes, I'll try my best to take individually in depth. Okay, we will look at it. Chala, thank you. Any